Hello everyone, hope all is well. I wanted to make sure that I got you some information about the ARRT mammography certification process. So what I'm going to do is just kind of walk you through the documents that are online for ARRT. That way I know for sure you have this information and then you're kind of seeing, all right, this is what I need to do for this category, so on and so forth. So let's get started here. So this is just basically the main mammography page with ARRT. If you want to be able to ever access this quickly, just Google search ARRT mammography, and this should be the page that kind of comes up. What will happen is that there's going to be the what they're calling the post-primary discipline handbook. Essentially, they've linked all handbooks together now to basically give you the general synopsis of what that information is going to look like. So just kind of clicking onto that, and it usually takes a second to be able to load it. We'll see. There it is. So it's actually pretty quick. So these handbooks are only good for 6 months. So every 6 months there is going to be a new handbook that essentially populates, knowing that your clinical experience is going to run through December. You're still starting your clinicals within this handbook, and where you're going to be documenting your repetitions through ARRT is also going to be online. So you're basically going to be bound to this handbook based on when your repetitions are going to be documented. So just kind of looking through the information as far as what's pertinent, of course, information about scheduling your test, that type of thing, it's all within here. But as a radiographer, of course, you can get certified in mammography, and none of the other primary disciplines can actually become certified in mammography, so that's more of a heads up than anything else. Make sure you always read the ethics section. ARRT always asks questions about ethics, a little bit of information about structured ed. That'll be satisfied through your coursework here at the college, so you won't have to worry about that. Essentially, you'll just have to submit your transcripts to ARRT as verification of that completion. Other information, let's see. There's some other good information in here. Let me find it. Hopefully they didn't take it out on me. Here we go. Here's what I was looking for. So a little bit of information about the mammography certification exam itself. You can see, scroll down to mammography. There's only 115 scored items. So when you look at that in comparison to some of these other registry certification exams, it's pretty light. So then you can see essentially categorically how many questions are going to come from what. There are going to be pilot questions that are going to be embedded. It's not the first 25 or the last 25. They're embedded throughout, so you don't know exactly which of those questions are scored versus pilot. But you'll take a 140 question exam essentially. You'll have 2.5 hours to be able to complete that exam. And then categorically speaking, we'll kind of get into the MAM's information kind of going forward. But you can see a little bit of information about ARRT stuff as far as, hey, once you get your certification, you can start to use that designation, the M behind your name, which is awesome. That's the goal here. And then some information about CQR, which you would fall into for your certification. So making sure that you're remaining competent in mammography over essentially a 10-year period. So in order for you to keep your M, you have to make sure that you're completing your continuing education requirements. So that information, essentially you can find a little bit of information about structured ed here. Like I said, you will be fine with structured ed. You can click onto that. That may be helpful for you. And then clinical experience requirements will be helpful for you as well. I'll go through these. You can either click it here. This is just for all post-primary, so you'll have to go down to mammography, or you can go back to essentially where we were before. So this one is effective as of the 15th. So this is the one you would want. Looking at this, so it gives you a little bit of information about essentially MQSA requirements plus ARRT requirements. So MQSA really is the you're a mammographer after you complete your 25 supervised reps essentially per FDA MQSA standards. So you can see that that's required, but in addition, ARRT does require those 75 additional exams. So total, you're going to be doing 100 repetitions for mammography. In addition, you should be prepared to be able to complete any of this patient prep and education based tasks, and also be knowledgeable about the procedures themselves. So some of our assignments are kind of designed around some of these ideas just to make sure that you're up to speed there. Additionally, you'll have to make sure that you participate in QC, and that it's all based on the QC intervals provided essentially by the manufacturer. So of those types of things that you're going to need to be doing, you can see some of these are listed here. So you can see how many repetitions are required there respectively. So make sure that you do remember that, hey, it's not just about the mammography reps, but I got to get in some of the QC time. And also you're going to have to spend some time with the radiologist. So you're going to have to review at least 10 MAM exams with a qualified physician. So MQSA qualified radiologist. So make sure that you do that. And then some information about elective procedures as well. So must participate in at least 4 of any of the following, so you can see, what those may be. The more I think that you can participate in, the more well-rounded your educational experience is going to be. So I would definitely encourage you to say, hey, if they're going to do these procedures, see as many as you can type of thing, but also make sure you get your reps in there as well. So in a nutshell, that's the requirements for mammography. The other kind of component of things that I would encourage you to kind of look through, though, is the test-based specifications. Let's see. So scrolling down, and I'm just at that main page here, mammography content specifications. Clicking onto that, you can see now, of those 115 questions that are going to be asked, that 35 are going to apply to patient factors, 47 instrumentation, and 37 about breast imaging procedures. And you can kind of break it down there. So, 35 then becomes subsetted, so 12 are going to come from ideas that are associated with information here. So I always like to use these as study guides, making sure that you're kind of verifying those types of things. If you have the questions about any of the content, feel free to reach back out to your course instructor to make sure that they're helping you effectively kind of answering those types of questions. So that would be the go-to. So your IMG 350, IMG 355 course instructor, Gina Arnold, would be kind of your go-to to make sure you're reaching out to for any questions that are content specific here. So you can see so what is instrumentation all about? And you can see where that information kind of falls in there. And then the other sections there, a little bit more about instrumentation here. So make sure that you're understanding the purpose of these tests and then how often that they're conducted. And then other ideas, and here's the procedure-based questions. So 23 of these procedures are going to be specific to mammography exams, and then there's going to be 14 questions that are about special patients. I would definitely expect to have a question about males, and let's see, I don't know if there's implants are here, but since those are both pertinent to MQSA, probably are some areas to kind of consider as well, kind of going forward. So in a nutshell, I wanted you to be able to say, all right, now I know where the information is at and located about, where are the content specifications, where are the clinical specifications, where's the handbook. So this is going to be kind of your lifeline kind of going forward. But if you haven't applied for an ARRT post-primary exam in the past, the documentation process is an electronic documentation process. So you'll have to sign into My ARRT. Once you're signed in, see my information there. We'll see. So once you're signed in, essentially you just hit on to pursue post-primary certification and registration. You click onto that. And I've did a demonstration for MRI here before, but you're going to just click onto mammography here, follow the promptings, and then that's how you're going to essentially document all of your repetitions. So make sure you do that process. Of course, I have the paper process for the first 25, kind of in addition to this, but just make sure that you're utilizing the electronic documentation process here as well. If you have any problems with ARRT-based information, here's a nice call line to be able to kind of correct those types of things there as well. But I'm more than happy to kind of walk you through this process. I think I'm at a point where I understand MQSA quite well, so I should be able to answer a lot of those questions for you. If not, I'll definitely hook you up with the appropriate personnel to be able to say, all right, this is exactly what you need to do, how. But for the most part, it may seem like a daunting process, but once you kind of get familiar with the language, it's really not too bad. It's just making sure you essentially check all of the boxes as you go through the process, and that's what we're all here to do. So the documentation is kind of designed to kind of be those checkpoints. So if you have any questions, be sure to let me know, and otherwise, I hope your clinical experience is absolutely amazing. Thanks a lot.